Those kids are cute. Well, 30 million Americans suffer from sinus problems. The pain, pressure, and congestion can be extremely irritating. But many patients are breathing easier thanks to treatment. And that's the focus of tonight's Mississippi Valley Health Report. There are several types of sinus problems. They can be caused by lingering colds, recurring allergies, and nasal blockage. When the problem progresses for months or even years, it can become chronic sinusitis.
People with chronic sinusitis, for instance, they often say they don't have anything draining out the front of the nose. It's just this thick phlegm feeling in the back of the throat, and it's often worse in the morning when they first wake up.
Carl Knudsen is one of Dr. Tyner's patients. He went for years without treatment for his sinus problems.
For about 50 years, I could sleep only on one side. So that was not only a sinus issue, but my right shoulder was hurting.
The problem also affected his work.
I've suffered from sinusitis, chronic sinusitis, bronchitis, and as a former radio announcer, there were several days a year that I couldn't talk.
But that has changed since Carl had surgery for a deviated septum. He now breathes and sleeps much easier. The surgery is less than 2 hours and causes only mild discomfort.
So often within 4 or 5 days after the surgery, people are already breathing better. They can tell that there's less drainage.
But sometimes surgery isn't necessary.
The good news is a lot of those patients, if there's no physical or structural problem, will respond to more aggressive antibiotic therapy.
Symptoms of sinus problems include a loss of your sense of smell, nasal congestion, fullness in ears, drainage trouble, tasting food, frequent headaches, and facial pain. You can find more information at WQAD.com.